Dr. Ellie, for that wonderful presentation. And we don't have Iman right now with us, so we'll move on to the next topic. We have Dr. Swati. She is our dynamic WOW leader, regional lead from Asia Pacific, and also the scientific committee chair for the WOW. And she'll be speaking on the international fellowships and observerships.
Thank you so much for this opportunity, and speaking on the platform of WOW is like speaking from your own home, because we all have been so closely associated to WOW and WAS to start with, that it's a great honor and pride to have something being done for women in India and across. So with this, if we start about fellowships and observerships, then we need to understand what are we actually looking at. So these are not just fellowships and observerships that you are dealing with. These are global partnerships that you are creating on an individual level and the institution you go back and join with. And also it's kind of a collaboration. It's a global health work in which we all are together and we thrive with each other. So as Rosa very explicitly and very nicely said that, everywhere the women's the body is lagging, be it their early career or late in the careers. But then we all know that women are less likely to receive grants as compared to men. Again, the industry support, a lot of times women are not treated as surgeons, they're treated as nurses, because a lot of times the patients come and tell you that doctor, not doctor, as a nurse. So they kind of still the mindset is like that. Again, when we talk about the income, women doctors are sometimes paid less than men in a lot of corporate hospitals that we know of, and also are underrepresented in surgical specialties, with which reason was came up that we should provide equal opportunities for women. And this is again the reason that we are collaborating ahead with WOW women throughout the world. Also, when Rosa very nicely said that there's a less surgical exposure as compared to men. So what are actually women are more likely to subspecialize in medical retina and other pediatric, in which requires a lot of OPD work as compared to the surgical, because they say that if we see the OPDs and we take care of the surgical, the opportunities become less, because they have lots of tasks to perform and they are kind of multitasking all the times. So with this objective, the WOW came up with this idea that we should have an international fellowship and an observership, and it is for those women ophthalmologists, and particularly from developing nations and also from developed nations, because sometimes they lack surgical or clinical skills and research expertise. And also the fellows who are trained, would be trained, are expected to bring this acquired knowledge and skill back to the native countries. So like Ellie said, that you go back and you work on a lot of different aspects like prevention of blindness programs in your country, or other programs that you can think of. And it's again a kind of spreading education and professionalism in your own country amongst your own peers. So as I discussed this long back also, when we did this Asia Pacific region seminar of WOW, and there are as many as practicing and ophthalmologists there are very less number of non-practicing ophthalmologists. It doesn't mean that women are staying back home and not doing anything. They are practicing, they are out after doing residency, but they are also interested in further training and a fellowship. Most of these women, they want to train again and again, and our branch is like that we have to keep up with the pace of the technology. So we need trainings back and forth again when we are doing it. And it is also that women are very open to traveling to actually depends on the institute that is offering the training or the time frame. They are very open to that. They are easy to adjust also. There's very little number that says that I cannot go because of various reasons, but then that happens with males also. And they are also ready to relocate. So this is such an important graph, that they can actually relocate to other countries, to other cities, even for a short time, but they're ready to relocate, and as much as up to 1 year or more. So we need to understand that it is not that the women are not coming forth. They want to train themselves, but we need to plan, because women need to plan before, as compared to men. I think we have to get our priorities right and the focus right before we finish residency. So it should start right at the time of residency. We should be very focused in which subspecialty we need to be trained, because the time is short and we have to train in something that interests us, or maybe that is the need of the hour in our region. And it is very important to get some research experience while you are doing your residency, come out with papers, have a nice CV. You travel for conferences, like Ellie said, networking is very important that you should follow. Then also working in a particular subspecialty, always try and train yourself in a subspecialty, because it's kind of a opportunity to network in that area. A good word from an accomplished surgeon goes a long way in your application. So if you get from the head of the institute and a letter saying that this is how you were in your residency and these kind of publications you came up with, a lot of people who know your mentor would be happy to take you and would be easy to take you. But also keep in mind that all these fellowships are usually sometimes not paid. So you should have a little financial backing when you're coming up, because then you might, even if your salary during your fellowship it is meager, and also it will not cover your other expenditure of travel and staying and accommodation. So but what are the advantages? You build relationships that goes for a lifetime. You have a word of knowledge to offer, because when you stand up at a podium and you are trained in a good institute, they actually take you a little more seriously, and women are taken more seriously than others, definitely. And train with giants in global ophthalmology field. Wherever you go, you should try and train with people who are experts, and this is how you can come back and you can actually train others also. WOW has a definite objective, is that you are becoming a part of global ophthalmology community, which is very important, because there's so many people we connected when we became a part of WOW, and this is how we were able to make new friends, a lot of opportunities that we can create for others, if not for us, in this community. And gain the skills to start your own program, because that's very important, that if you don't go back and give it back, like women should help others. This is what Rosa in one of her slides said, that we have to help others. Susan also said this. So this is what is the crux of getting a fellowship in national observership and become the doctor who inspired you. So when we are talking about observerships, this is what we are looking at. These are the research fellowships or observership. They could be clinical fellowships and observerships. It could be pure mentorship. You might not need a fellowship or an observership, and it could be just for networking. So this is how it can be divided. Then you always, these mentors and these guidance from others, it becomes a guiding light through your residency and also beyond. And mentoring during your early stages of career is very important, because see, we are never short of patients. At least in India and Asia Pacific region, we can say we are not short of patients, but it's just that we are not getting trained into a subspecialty that we can take care of. So the roadmap should be like, we should be the training requirements, both that are suitable to the institute and to the individual, the duration of training, the subspecialty or the fellowship training or observership. We want to train in the career information. What will we do after getting trained, and where are we going to go back? Little knowledge about this. Then who are the other faculty who are also involved in this training? And also, like Ellie said, that's very important to get involved in national organizations. Like you go back to your country, you join your conference, you present your papers, and you kind of mix with your peers. This is how it helps. So it's all about women helping women. I again reiterate that what other speakers have very nicely said, that we are trying to fulfill this yawning gap. It is just not the competition between men and women. How would men take up or how would women take up? It's just about the gap that should be filled. And each fellow has to be paired with a mentor for the duration of the fellowship, bound by a customized curriculum. So it is very easy. You can always say that I need a customized curriculum to my needs. I need this time frame. I need this kind of a mentor. And this is how we can collaborate and connect. So supposedly, if I cannot mentor somebody, it could be somebody else who can mentor the same person in that same space and to the same extent. So simple strategies are the most effective, because we should go very slowly, and keep your aims simple. You should know what you want to do, and this is how we seek to build a diverse and inclusive cohort of fellows. These are some of my mentors, my friends, my guiding lights, and there are many more that I have come across. But each one has a specific time frame in your life, so you need to recognize that and thank each